Hi, I'm Dr. Joel Beachey, one of the fellows in the cardiology program at Mayo Clinic, Rochester. We're here at ACC 2018, and I'm pleased to be joined by Dr. Klarich here. She's our former program director of our cardiology fellowship at Mayo Clinic in Rochester and is just about to take on a new role as clinical practice chair at Mayo. Thanks for being here.
Oh, thanks, Joel. It's great to be here and always fun to meet the FITsontheGO.
So I just wanted to talk with you a little bit today about your role as the fellowship director. We're currently undergoing a transition in our leadership, but we certainly appreciated all that you've done for our program over the past 8.5 to 9 years. You've certainly been a great educator for us as fellows, and we've really enjoyed having you as our director. I wanted to ask, what initially got you interested in medical education and leadership role?
Well, Joel, I think it comes out of a love of learning to start out with, and then that kind of blossomed into a role as chief medical resident, actually, back in the day. And coming to Mayo, I think it's always been an area of interest to work with people that are also learning, and then to also advance your own knowledge of, medicine as you learn along with your learners.
Right. Okay. So I know. So at Mayo, we kind of look at the three shields of our logo. One being education, one being research, one being clinical practice. And I think that some people who might be interested in education might think, well, I'm also interested in research, and can I do both? Can I really focus in research and also focus on education? Do you think that that's something that is a feasible thing to do in a career?
Oh, absolutely. I think that more today than ever before, we need people that are really committed to doing research in education. So you can actually combine a career in research with basic research or with educational research or with clinical research as an educator. They dovetail very nicely together. I think the emerging thing is really becoming an educator who understands best practices in education, and we need to define that not just for medical students and residents, but also the advanced fellowships that we see, cardiology and all of the other internal medicine subspecialties. Because as our time gets more limited in the clinical arena and the press of the practice becomes stronger, we really need to understand where we can place our efforts with the biggest bang for the buck, if you will, in terms of teaching and learning for our fellows. And then, of course, part of that is getting evaluations and feedback, not only formative feedback, so day-by-day feedback that residents and fellows need to really advance their skill set, but also the end of the day, you want to know, did that resident become competent? So I think those are really important areas for people to build a career around, and I think even as we've become more and more subspecialized within our clinical practice, we have to be identifying people that really have a passion for education. I think it's a very viable academic career path.
Great. So what advice would you have for fellows who might be interested in getting involved in education early on as a fellow or in their early careers?
I think you want to, just like as a researcher, you really want to align yourself with people that can mentor your career along what it takes to become an educator and have that physician-educator role in academics. So, obviously resources within your program would be your program director and the associate program directors, but there's at least from my point of view at Mayo, what we tried to do within cardiology was build a community of educators so that we had people that were identified as the lead educators in each area, like the cath lab, the electrophysiology lab, echo lab, all of the different subspecialties in nuclear, where people could then kind of build the combination of maybe an academic career in education, but also maybe some clinical research too to support that.
Great. Well, thank you so much for your insights. We really appreciate you meeting us here today.
Well, it's a great pleasure, Joel. Thank you for inviting me.
Yes, thank you so much. For more videos like this, please visit us at youtube.com/FITsontheGO.